I know this is only theoretical. If we were to recommend dosing of the tablets for something like that to help reduce that sort of pain and inflammation, are we looking at twice a day, three times a day, like split doses across the day?
Yeah, it's a good question, and we really need more research because the tablets have been quite helpful to drive more clinical research because, like I said, it provides a high and consistent dose. But most clinical studies are at a lower dose and a lower concentration. But that's because there hasn't been something available, right?
Hmm.
Like back when the clinical research first started happening, you were lucky if you could get even a 1 milligram per liter or 1 ppm hydrogen water and try to administer that to subjects. And yet we could see that there were benefits, but now doing some of those studies again with higher doses, like metabolic syndrome,
Hmm.
we see greater benefits. And so maybe getting this higher dose and higher concentration is a more effective way. But we need more clinical studies to really know. And so at this stage, in a lot of ways, people like you help to drive the research because if you're coming back to us researchers and saying, hey, based upon our clinical experience, it seems that patients don't really start getting better until they're receiving two or three of this hydrogen producing tablet, which equates to, this many milligrams of hydrogen. And then we sit back and like, okay, interesting. Let's do a clinical study on that and maybe compare different doses and try to figure out, what's going to be the best way. And collecting the data